On Monday, Premier Scott Moe was asked if Saskatchewan was accurately reporting COVID-19 related deaths. He was in response to a suggestion from a University of Toronto researcher that suggested that Saskatchewan's death toll could be 7 times higher than reported. This was his response.
For someone to indicate that the majority of those are due to COVID is just simply nothing short of some of the most egregious misinformation that I've seen throughout this pandemic, and it really shouldn't be spread.
Yesterday, the researcher Tara Moriarty posted a letter on Twitter defending and explaining her work. Moriarty is the lead author of a study into mortality during the pandemic. The work was peer-reviewed.
It's not egregious misinformation, right? So when I was responding to it, that's what I'm responding to, saying, this is a major report from the Royal Society of Canada, peer-reviewed by some of Canada's leading, epidemiologists and medical leaders.
She says Saskatchewan is not alone in underreporting deaths, but she feels it is one of the worst offenders because of how long it takes for them to be reported, and because the province does not do post-mortem testing and has a lower testing rate than other provinces.
At minimum, even just from the age of Saskatchewan cases and the expected mortality rates for different strains and for whether people are vaccinated or not, Saskatchewan has not reported at least half of the deaths that would have been expected just by doing the math on the reported cases.
Moriarty says she wants deaths reported quickly and accurately to give Canadians a clear picture of the impact of the pandemic. And despite the Premier's comments, she says she's willing to work with the government. She says the government of Quebec has noticed her work, and she met with them on Monday. Adam Hunter, CBC News, Regina.